Hi guys, how are you? This is Dr. Kim, and for this video I have another question for you, and that is with this radio opacities that we see bilaterally on this periapical radiograph. So let's take a closer look at these two opacities. Here we see periapical regions of the mandibular incisors and a very large and prominent and very dense appearing radio opacity is seen bilaterally, and these opacities are obstructing the visualization of some of these premolars. So what could this be? In order to gain a better visualization and appreciation of the size of these two opacities, we're going to then look at the adjacent radiographs. So let's look at this one. We can again see, although it's not as it does not show a well-defined border as it did on the other radiograph, you can partly make out the border of this opacity, and it's clear that this zone, there's a zone of radio opacity, and which makes it more difficult to visualize the PDL space of this particular premolar. And the same is true for the other side. As a matter of fact, as you compare these two radiographs, the location and angulation and also the size of opacities are very similar to one another. So let's take a look at this. Once again, we see this prominent large radio opacity, and again it hinders the visualization of the PDL space of involved dentition. I do want to make a quick note that this opacity is different from this opacity that we see at the bottom of the radiograph. So this is an example of a cone cut image. And let's continue to look posteriorly. Again, this area is highly radiopaque, and although it's difficult to determine the exact border of this opacity, we can see from this radiograph that the opacity appears to extend all the way to the second molar from what I can tell. Now let's take a look here. Here again we see that opacity, and again there's a zone of opacity. As far as how far does it extend distally, I think it is a little hard to tell, and I want to better demonstrate that. So here we have opacity, again hindering the clear visualization of the PDL spaces of these molars, and another view of the area. So what is the best differential diagnosis, or best differential diagnosis of these radio opacities? So that's the question of the day, and I hope you found this case very interesting and informative, and I'll see you in the next video. Thank you.